New research on marijuana is raising health concerns this morning. A study in the Journal of the American Heart Association suggests that young and middle-aged adults who smoke pot could be putting themselves at risk for heart-related complications, even death. CBS News medical contributor Dr. Narula is a cardiologist at Lenox Hill Hospital in New York and joins us at the table. A lot of people are looking at you, doctor, going, what you talking about, Willis? So we'd like to know how this study was done and what did they find?
So this was a study that took place in France, and basically they looked at patients who had reported serious cardiovascular events. And they looked at those patients who had reported using marijuana in the setting of the prior year. And what they found is between 2006 and 2010, there were 35 cases of serious cardiovascular events, 20 of which were heart attacks. Several other were strokes. They primarily occurred in young males around the age of 30, and 25% of these cases resulted in death. So these sound like very big statistics, but overall the case number was very low. The concern is that it raises a flag about a possible signal for a link between marijuana and serious cardiovascular complications.
I mean, do we really know that the marijuana caused the heart attack?
We don't know that, and that's really the big question. You know, this study was not the kind that we can say cause and effect. This proves this. It is also confounded by the fact that some of the patients used tobacco or alcohol. It required self-reporting, so the people had to say, I used marijuana, and the doctors had to ask and then report it. So there's a lot of information that's confusing.
And if you had to self-report, how honest would you be about, yes, you know, I've been using marijuana?
That's exactly right.
Seems like that would raise a red flag.
But I'm curious, doctor, since you're a cardiologist, how might pot affect the heart?
Sure. So we obviously need more research about this, but we know that marijuana can cause several changes. It can increase the heart rate and blood pressure, which increase the oxygen demand to the heart. It can decrease the oxygen supply because it raises carbon monoxide levels in the blood. It can cause arrhythmias or abnormal heart rhythms, be toxic to the heart muscle, and cause increased clotting in the blood vessels that could lead to heart attack or stroke.
Even with occasional use?
Even with occasional use. There was one study of 3,000 patients that showed in the 1 hour following smoking marijuana, there was a 5 times increased risk of heart attack.
Wow. I was wondering that too, Nora. Are you talking about people that use it all the time or people that just occasionally?
Right.
But you're saying it doesn't matter. So what are the implications going forward?
I think the biggest thing is, has the science really lagged behind what's happening politically in this country in terms of legalization? And we really need more research to be able to say definitively that marijuana doesn't have these serious side effects. Marijuana has been listed as a Schedule I drug, which, you know, by the DEA, which means that we haven't been able to test it really in clinical trials.